The topic is digital platforms of FOMIT, the future of lifelong learning. The speaker is Dr. Harish Pende, who needs no introduction. He is a professor of pediatrics in Kalavati Saran Children's Hospital in Lady Hardik Medical College. At present, he is Vice President of Indian Academy of Pediatrics activities in JR Medical College. He used to organize, and he is a keen learner and a very good teacher. I request Dr. Jyoti Prajapati to introduce the topic, please.
So, sir is going to deliver a kind of learning and on our patients and our PG students also.
Growth chart is okay, weight is okay, activities are okay. He is doing everything normally, but not eating something which mother wants to eat. He is eating something which child wants to eat. So students are also doing something similar. They are not studying the way we want to teach them, but they are studying the way they want to study. Because they are passing in all classes, they are passing on the NEET also, doing PG, everything they are doing. So where the problem is? So as a mother should make good, interesting food to the child, we as a teacher should also be making our classes, our sessions interesting enough for the children. But then what they are doing, how they are learning, and how various technologies are being used by students and teachers. So I will talk about it. When I was preparing for this lecture, I found that I am too ignorant about all those platforms. Okay. So I found this saying by William Osler, the greater the ignorance, the greater the dogmatism. So if we do not know about something, so ignorance is not only lack of knowledge, but lack of awareness. So if we do not know something, we are not very sure about what that thing is. Whether this is good or not good, but then we confuse and say, no, this is not good. We are dogmatic about it. Okay? And this attitude, if we say AI is bad, online classes are bad, then this stops us in learning more about it. Okay? This is opposite to skepticism, and this stops critical inquiry. So what should be done? The famous philosopher Socrates says, he was wisest man precisely because he understood what the limits of his own knowledge. So when we understand what we do not know, that becomes the first step of learning. Okay? The sign of a truly learned mind is the willingness to change one's mind. When we know we are failing in having more and more attendance in the class, we must try to learn what we need to do. So willingness to change is the beginning of learning. Okay? So learning objectives for this particular lecture is that at the end of this session, we should understand diverse learning strategies adopted by students and should be adopted by teachers also. Explore effective online learning platforms, lots of information which is available, and appreciate the emerging role of artificial intelligence in transforming medical education. What are the prerequisites for effective learning? We all know about it, just a revision. We have to be cognitively good. We have to be updating the knowledge, understanding competencies, effective teaching and assessment. We should be receptive to feedback from the students also. Okay. Safe and respectful environment. We talked about safe environment, AC and other things. But respectful is also very, very important. And modern essentials to the good teaching is digital literacy, teamwork and communication skill, and ethical and patient-centered or student-centered focus in our teaching. So what is digital literacy? This is ability to effectively and responsibly use digital technologies for learning, teaching, research and patient care. How much are we using those things today? And from a medical point of view, digital literacy for medical faculty means ability to effectively, ethically and creatively use digital technologies. So we need to be very, very creative and innovative in using those technologies. We should not be averse to using them, but we have to find ways to using them for the benefit of students and patients. For students, various informations are available like PubMed, WHO or UpToDate, critical appraisal of online data is available, active use of their various learning management platforms. They need to practice digital professionalism and they are much more familiar with digital tools. For faculty, we need to be competent enough in technological enablers, enabled teaching. For presentation, videos, simulation, virtual classroom, we are witnessing many of them in this conference also. And we should also be able to have skill in online assessment and e-feedback system. And we should incorporate open educational resources and this free open access medical education contents responsibly. We need to promote digital professionalism and mentorship in online classes or online spaces. We need to encourage hybrid and blended and self-directed learning among students. There is a session and time is given to students for self-directed learning. Okay. And we need to learn how to do that. What are the core competencies for faculty for digital literacy? Like we have to be informed and content literacy on many things which are available. We also need to learn digital teaching and learning skill, like in blended learning, e-content creation, use of simulation and virtual platforms, flipped classroom techniques, engagement tools like Mentimeter and Kahoot. Someone was saying we should have some MCQs and those surveys during the session. We can do it using those resources. Similarly, assessment and feedback literacy also we should have. Creating good MCQs, good OSCEs, then maybe interest of the students may increase. And timely e-feedback also we should be giving to those students. The research and data management skills are also very important for our postgraduate teaching. And various literature management tool and should be known to us, data analysis platform, and using various plagiarism detection tool. They are all part of the duties of a teacher. We need to learn those things. And we have to be good communicator and collaboration. So various tools are available for those communication. ResearchGate, also in LinkedIn. In faculty interviews, people are asking what is your H-index. So H-index is related to how many publications are quoted that time. H-index is 10 means 10 publications are quoted at least 10 times. Okay? These are available from ResearchGate and other platforms. Then virtual collaborations are happening. Digital etiquette also we need to learn, writing email, how to respond to the email and other communications. And we also need to learn digital professionalism and ethics. Continuous professional development. There are many things available. The Government of India is really very serious about this continuous development of the faculty and continuous development of their employees. Just few days ago I said the whole day in a program by Government of India and learning about culture, inner power, outer power and various things. So they are forcing everyone to learn those things through digital tools. And those MOOC courses, CME courses, many things are available. And iBot is the platform of Government of India where all government officers have to do at least 3 courses and mention them in their annual appraisal. So these online things are happening very fast. So how to empower ourselves? By learning the digital literacy skills, we empower ourselves to use online platforms ethically and effectively. So online platforms are not bad. So what our students are doing? They are learning through those online platforms. What is Marrow? It is also an online platform. Okay. They are spending thousands of rupees and seeing those videos. So this free open access medical education or FOMAD is the name given to this free access medical education. This is a concept, a movement, a drive of many people who have come together, especially from emergency medicine, and they have created some platforms. Now many platforms are available where lots of learning materials are available in various forms, and students are going there and learning. I will show you one study also. So this term was coined in a pub. So not every innovation happen in a bathroom. Something can happen in a pub or a cup of beer also. So they coined this term free open access medical education in Dublin in a pub. This is a collection of resources, community and ethos to make the world a better place. So these things are available on that, and FOAM is a concept and format is the hashtag on various social media tools. These things are available. This is very interesting thing to know, that if you want to know how we practice medicine 5 years ago, read it also. If you want to know how we practice medicine 2 years ago, read some papers and journals. If you want to know how to practice medicine now, go to a good conference. If you want to know how we will practice medicine in future, then listen in the hallway and use those free open access medical education platforms. Okay? So this is for futuristic thing to use those platforms. So I tried to find which platforms are available, and I was really, it is amazing that many are available and I did not know about. So one is this, don't forget the bubbles. This is for general pediatrics and pediatric emergency medicine. They have blogs, infographics, podcasts, articles covering a huge range of common and acute pediatric presentations. The next one is pediatric emergency medicine morsels, concise pediatric emergency pearls, weekly posts in a quick bulleted forms. You can learn very quickly using those things. PEM blog, pediatric FOAM, FOAM, PEDS cases, KIRT siders, there are many which are available. Okay? But we don't need to go to many. Find one or two which are good for your interest and try using them, begin using them. There are certain platforms for medical educational technology learning also. Okay? These are the like Medics Academy, Erudical, Apoia, Stanford University, EdTech, Moodle. I have not tested them, I have not found them or analyzed them, but many things are available online. And free courses are also available. This is one pediatric free open access medical education. And many things are available here, I will tell you. Like cardiology, community pediatric, child protection, endocrinology, evidence-based medicine, and many neonatology, P2, respiratory. Those resources are available. They are not same as the textbook or the journal articles, but they are presenting the information in a very innovative way. Like this, on neonatal thrombocytopenia, maybe one write-up will be there, which you can finish reading in 5 to 10 minutes. Okay? Sir, I remember one textbook was there, 5 minute pediatrics. Okay. This is similar to here available. And books, maybe it's 4, 5 to 6 years old, they can update very frequently. So we can rely on them, and updated knowledge is available on such platforms. This is about case presentation, PEDS cases. Many cases are available on this. So students can learn using those cases also. And pediatric education online are available. Our own DIEB platform. Thousands of recorded sessions are there. I don't know whether we are using them or not. Okay? And I'm sure many of us have participated in creating those contents. So the question is, are they all good to use? How to decide whether they are good? How to find whether the information contained in this platform is authentic? This is the big issue. Okay? And can we use this in our practice? Can we quote them? Yes, we have studied and read this from this platform. This is the difficult part of it. But not very, very difficult. There is a way to find. Okay? And this scrap. Currency means when the particular material was created, whether it is relevant, who has created it, how much accurate it is, and what was the purpose. Okay? If we can have this kind of analysis on the online material which is available, we can easily find whether this is to be used or not to be used. So currency means its time, when it was used, because medical information is becoming old very fast. Okay? Next part is relevance, whether this is relevant to us, to my place, my country, my district, my clinic, my practice. This we need to find. With the information at an appropriate level academically. As a teacher, you need to teach first year, second year, third year, MBBS student, then maybe MD student, and then your DM student also. So you have to find the level. And for whom particular resource has been created. Okay, this is also important. Because many resources are created for parents. Then are we using for medical students or not? This is a very, very important thing. Authority and authorship. So in a journal article, you will always find name of the authors are there and their affiliations are there. So this give you a kind of a confidence and trust. If this article has come from this particular faculty, from this particular institution, this will be a good one. So we can again check who has made, who is the authority and who are the authors of that online material. Then accuracy, this is difficult to test, but if you know the subject well, if you know the basics, then you can find whether the contents are accurate or not accurate. Okay? Purpose, for which these things were created. So by this scrap test, we can find whether it can be used or not. A little bit about in 3 to 4 minutes about the artificial intelligence. Friends, AI is not bad. AI offers a whole new world to us. We all need to learn to use it appropriately. A medical practitioner or a medical teacher who uses AI will be better than those who don't use it. Okay? Mark these words. We all need to learn the AI. A medical teacher must know the AI. How? There are several AI tools available, like digital literacy, we need to have AI literacy also. So one category is general generative AI tools like ChatGPT, Gemini and Claude. And LLMs is large language models which are there. These are also large language models. We need to learn about the meaning of these terms. And for second category is AI-powered learning and content platform. You must have seen various slides, very nice slides made by some of the faculty members using various AI tools. So Emboss and Hubert, you can have a performance analytics. These performance platforms track student performance, identify specific knowledge gaps. So we can use such AI tools for tracking the progress of the students. Brandscape and Lecturio and other PubMed integrated tools are also available where we can do a very quick literature search. Instructions and design and media tools. Video creation with avatars. This can be done easily. You need not to learn the softwares. AI will make videos for you. Tone and drama for presentation design. I have not used those things for this presentation, but one can use those presentations, those tools for making very nice presentations. So which are the best ones available? 3 best ones for us medical teachers. This is from Neural Concern is from Stanford University. This is Space-like AI medical learning platform. So OSCE case simulator is there, exam question generator is available, AI medical certain flashcards are there, and this explicitly lists AIIMS Valley as a partner. So again, authority is there, AIIMS Valley is a partner in this, so maybe we can expect this may be better, but still we need to analyze whether this is good or not good. BizzyNerve, this is becoming very, very popular. Okay? Students are using it. This is WISE AI chatbot, BizzyNerve is available. Cortex AI. If you upload a file or a presentation, they give you golden points to remember, or golden points to revise, quick revisions. Okay? And adaptive test series are available. And these platforms are built especially for MBBS curriculum and highly competitive NEET PG exam environment. This may not be free, but not very costly also. These things are available. The third one is again general large language models and integrated AIs and POS and other things. These also are available and we can use them. Okay. Free online courses for medical education technology. IAP may not be having, but many institutions which are giving free online courses. So we can learn medical technology, but we have to do those NMC approved courses. But still, to learn more, we can use these various platforms. What are the key challenges for us, the educators? I'll take 2 more minutes. The challenges that educators must address is AI literacy. We have to become AI literate. Ethical integration in the curriculum must address the ethical, legal and cognitive risks like automation bias associated with relying on AI for diagnosis, etc. should be addressed. We should not be using AI for everything. We have to learn the subject also. And some humanistic skills like AI cannot replicate empathy, communication or building rapport. So we have to prioritize teaching these humanistic elements more than teaching knowledge-based things. So knowledge they are getting from books and various online open access platforms. So as a teacher, we need to invest more in teaching humanistic elements like AdCom, ethics, communication, attitude, these things. So integration of AI is seen as a paradigm shift that requires medical education to transition from teaching information retrieval, as is done mainly in the classes, to teaching evaluation and synthesis. So whatever large amount of information which is available easily in the phone, we have to teach them how do they manage that information, how do they evaluate that information, and how do they synthesize meaning from the whatever information that is available. So are we ready for AI? Maybe not ready. I'll just quickly show you one slide. So there are very questions were asked from faculty and the students, whether they are ready or not. So it is found that students are rather more proficient in those AI tools than the teachers. We have to match the students' learning in the use of technology. So we need to harness the power of AI tools to empower teaching, learning and assessment experiences by promoting personalization, co-creation and critical thinking in the students. Okay? So we need to learn those things, otherwise students are always ahead of us. We should not allow them to go ahead of us. We have to be ahead of them, then only saying AI, continuous professional development, etc. There are certain guidelines which are available for creating those open access tools. Because it is the duty of our teachers to create those online materials. Certain guidelines are there, certain do's and don'ts are available, and how to create open educational resources. We need to learn those things very clearly, and then only we can help our students. So friends, this is the first, then visionaries, then pragmatics, conservatives, and doctors are the last. We should not be last in learning AI. We have to quickly adopt those tools and be more smarter than students, then only we could be learned. So we should not remain ignorant of the virtual world that is being increasingly used by patients, parents, students and other pediatricians. We need to learn to use these free open access medical education platforms. We need to learn using AI for our daily needs in the clinic, daily needs in the teaching, but ethically and effectively. We also have a responsibility to create authentic online educational resources. All these duties we need to do it, but there is no escape but to learn whatever is available in the virtual world. Thank you very much.
Thank you, Dr. Professor Harish Vemde, for such an excellent talk on a very useful topic. Sir has already emphasized that methods to scan it and test the integrity of the researcher as well as the institute. Thank you, sir, for such a lucid talk. Let's learn, share and grow together. Thank you very much.
Thank you.